So please go ahead.
Yeah, Marwa, start, please.
Assalamu alaikum, everyone. Good afternoon and welcome to the College of Pharmacy celebration for the World Pharmacist Day, the day where we celebrate, acknowledge, and advocate for the pharmacy profession. With you, Marwa Shazli, I'm a P2 student and I'm the QFIS Vice President. Today, inshallah, I'm going to take you through the event categories and I would like to thank you so much for attending and for taking this valuable time to attend our event. So I'll start by sharing agenda for today. First, we will have the welcoming remarks by Dr. Mohammad Diab, the College of Pharmacy, and then welcoming remarks by Ms. Hind Naimi, QFIS President. Then we're having a keynote speech by Dr. Wissam Smeedi, the Assistant Executive Director of Clinical Services in the Mental Health Hospital, where he will tell us about the evolving role of the pharmacist during the COVID-19 pandemic. Then we're gonna have the thank you video, a thank you message video by the pharmacy students to all the pharmacists worldwide. Then we're going to have an interactive virtual game session. And then we're going to end by announcing the winner for the competition about building resilience in pharmacy students, which we announced before on social media and in the college. So to begin with Dr. Mohammad Diab, some welcoming remarks by him, with the Dean of College of Pharmacy and our supporter. You have the mic, Dr. Mohammad.
Thank you so much, Marwa. Assalamu alaikum and good afternoon all, CPH faculty, guests, staff and students. It gives me a great pleasure to warmly welcoming you to the CPH virtual celebration of the World Pharmacist Day, which take place this year under the theme of transforming global health. This event is jointly organized by CPH College of Pharmacy and Qatar Pharmacy Undergraduate Society, QFIS. The Pharmaceutical International Federation started celebrating this day back in 2009. And since the start of the College of Pharmacy at Qatar University, we have been keen on sharing the celebration and to stress on the importance of pharmacists as an integral part of the healthcare team, as well as their critical role in advancing healthcare. This year's theme aligns well with the College of Pharmacy in Qatar vision in advancing healthcare in Qatar and the world through excellence and innovation in pharmacy education, research, and services. So I really want to wish you an enjoyable time and want to thank the whole team of students, faculty, and staff who were involved in organizing this event. A special thanks also to our keynote speaker, Dr. Wissam Smeedi, who is a pharmacist and the Assistant Executive Director of Clinical Services in the Mental Health Hospital in HMC, who will be talking to you or to us about the evolving role of pharmacists during the COVID-19 pandemic in Qatar. So thank you again and happy World Pharmacist Day to you all.
Thank you, Dr. Mohammad. Next, we have the welcoming remarks by Ms. Hind Naimi. She is the QFIS president, but unfortunately, Ms. Hind wasn't able to make it to the event today because she's on her rotation, but she was able to record something here. I will share it in a second. Special thanks to Ms. Hind for organizing and for being able to record, although she was busy with her patient. And then moving to the keynote speech by Dr. Wissam Smedi. Dr. Wissam Smedi is the Assistant Executive Director of Clinical Services in the Mental Health Hospital, which is part of Hamad Medical Corporation in Doha, Qatar. He holds a BS in Pharmacy from the University of Toledo in the USA and a Doctorate of Pharmacy from Howard University in Washington, D.C. He also holds clinical certificates and certifications in diabetes care, cardiovascular care, lipid management, and immunization, and holds a board certification in the pharmacotherapy. With over 15 years of pharmacy experience in different fields, including majority in the US and currently in Qatar, Dr. Smedi brings valuable experience with significant leadership roles in pharmacotherapy in the capacities of patient relations, pharmacy management, clinical care, and pharmacy education. He's overseen the launch of a few different programs that are the first to be established here in Qatar, that include first pharmacy managed anticoagulation clinic, first antimicrobial stewardship program, and the first pharmacy managed medication therapy management clinic. Welcome, Dr. Wissam, and thank you so much for taking your time to be with us here today. Please tell us about the evolving role of pharmacists during the COVID-19 pandemic in Qatar. You have the mic.
Okay, thank you very much, Marwa, for the nice introduction. I want to start first by taking the opportunity to thank Dr. Ala and Dean Diab for reaching out and inviting me to be a keynote speaker in such a special occasion. What an honor and privilege it really is indeed to celebrate our World Pharmacists today with my fellow pharmacists and with our future pharmacists from the undergraduate class. You future pharmacists have a bright future ahead of you, and I can assure you we've come a long way in our pharmacy profession, and we will have many more accomplishments that will be relayed by yourselves in the future, inshallah. As Marwa mentioned, my topic today will be the evolving roles of pharmacists that have emerged during the ongoing COVID-19 pandemic in Qatar. Next, please.
Can you allow me to share, please?
Next slide, please.
I'm sorry, because I love the screen, so. Stream, I can't find Riemann Manani.
I'm sorry, who's going to present? Ms. Marwa?
Yeah, but I can't find Miss Stream here, so I make her the presenter. That's why. Yes, I'm pretty sure it's working now. Sorry for the issue.
Yeah, Reem is now the presenter. No problem, no problem. We can get this figured out. Okay, thank you. So next slide, Reem, please. Okay, of course, I have no conflicts of interest to declare at this point. The objectives I want to share with you, and which I hope you will gain from my presentation today, is I'm going to give you a brief background on the COVID pandemic, which I'm sure a lot of you are aware by now of a lot of information with COVID, because it's pretty much been the topic of the hour for the last, let's say, 6 or 7 months. I also want to touch base on the current status of the pandemic as it stands currently in the state of Qatar. I will go through detail on the evolving roles, once again, that have taken place for the pharmacists in Qatar during this ongoing pandemic. And I will personally recommend some future pharmacist roles that I believe will add value to the pharmacy profession and will help in managing this pandemic as well. Next, please. So once again, some background information on the pandemic. The COVID-19 virus is a member of the coronavirus family that includes the severe acute respiratory syndrome, or SARS virus. And this virus actually, ironically, originated in China like over 10 years ago, but it was fairly managed and contained. And you have the Middle East respiratory syndrome, or MERS virus, which also originated in Saudi in 2012, and for the most part has been fairly contained in Saudi Arabia. The COVID-19 virus originated in Wuhan, China in January of this year. It started to spread globally on an exponential scale. And unfortunately, as of March 11 of this year, the World Health Organization labeled this virus spread as an official pandemic. Now, typical symptoms of COVID-19, or the cardinal symptoms you may notice would be fever, shortness of breath, and cough. These are the most common symptoms. Now, you may have other symptoms that may arise as well, which include diarrhea, fatigue, sore throat. And I'm just going to digress for just a little bit here to talk about the fact that, as a lot of you are probably aware by now, we've entered flu season, influenza season. And according to the latest CDC guidelines, symptoms of COVID and influenza are almost synonymous. I mean, they're exactly the same. The distinct symptom that has COVID stand out, aside from influenza, is the loss of sense of taste or smell. So if you have any one of those two symptoms, then more likely than not, you'd be COVID, not influenza illness related. So I advocate for each and every one of us to please make sure that you get vaccinated for influenza this year, because it is more important than at any other time in our life to get this vaccination, to make sure we avoid any unnecessary trips to the clinics, any hospitalizations that may result because of influenza-related illnesses. So this is just a little digression to preach vaccination this year. I am aware that we've started vaccinations in HMC, and the healthcare centers have also started offering vaccinations as well. Now back to the topic. Sorry for the little digression there. As of now, up to date, the current infected active cases worldwide, and again, I'm talking about active cases, have topped 7 million cases. Now, having said that, from the origin of the pandemic up to now, the number of people have been infected worldwide has been over 30 million cases, which is absolutely incredible. Of course, with such a pandemic, unfortunately, you will have casualties. So we are unfortunately getting very close to having 1 million deaths as a result of this pandemic worldwide, which shows you that we should never underestimate the magnitude of this pandemic. And, you know, we have to look at ways that we can eventually tackle and beat this pandemic. Next, please. Okay, here I also wanted to share some data with respect to our state of Qatar here. You're going to look at the graph at the right side, and this has been derived from the reference is the European CDC. This graph will show you the number of daily new confirmed cases of COVID in the state of Qatar. And you will notice that the time frame spans from the end of December of 2019 all the way through the 27th of September in this year. You will notice that the peak started to go beyond March 11th, which is the launch or the official labeling of the pandemic. We reached in Qatar the maximum peak, you could say probably around the middle of May, where, believe it or not, we were having a rate of over 2,000 plus new confirmed cases of corona per day. But you will also notice that we have successfully in the state of Qatar flattened the curve. So going through June, July, and September, we are now at a rate where the curve has flattened, and we're hovering around 200 plus cases per day. And I just want to take this opportunity also to give kudos and recognition to the government and Qatar, and specifically the Ministry of Public Health, of taking all the precautionary measures and actions through the 4 different phases of making sure that, you know, people adhere to the lockdown that was taking place for a while, people adhere to avoiding social gatherings, making sure we're taking all the infection control measures of wearing masks all the time when we leave, social distancing, avoiding gatherings, hand hygiene continuously. All the efforts that have been done by the government have resulted in us containing the pandemic and resulting in the numbers subsiding the way they are. Another thing I wanted to touch base on is on the left side, and this is data that I've retrieved from the Qatar dashboard, which is a part of the Ministry of Public Health. You will notice the red number is the number of cases that have been infected in the population of Qatar so far, which is a little bit over 124,000 cases. Now, the positive note is, if you look at the green number there, that's the number of recovered cases from the cases that were infected, which is over 121,000, which indicates to you that over 97% of patients that have been infected in our country have recovered, which is absolutely astonishing and amazing. Of course, once again, as I've mentioned a little earlier, there are deaths that have taken place in the pandemic. And in Qatar, we are no stranger to that. Unfortunately, we've had 214 deaths up to date as a result of the pandemic. Now, if there is any glimmer of hope or positive sign we can take from that number, we can say proudly in Qatar that we have one of the lowest fatality rates of the pandemic worldwide, where you can see there the fatality rate is 0.2%. And once again, this is a testament for all the hard work that has been done by the government, by the Ministry of Public Health, by the healthcare professionals, which of course includes us pharmacists, and by the community as well. We got to recognize the community because they have definitely been adhering for the most part to all the measures that have been provided by the government. Next, please. Okay, so now I'm going to move to the core of the, the presentation, which is what are the evolving roles of the pharmacists that have taken place as a result of the pandemic in Qatar. But before I do that, I will give you some background information on pharmacists and the role of pharmacists that stands aside from other healthcare professionals. I think it's fair to say that in Qatar, as worldwide, we are among the country's most accessible healthcare professionals. And I will elaborate on that a little bit. What I mean by that is whether you have pharmacists that are working in a hospital setting, an inpatient, whether they're working in an outpatient setting, whether they're working in community pharmacy, healthcare centers, clinics, we are readily accessible by the patients. The patient can walk in and see us. We don't, in other words, patients don't need an appointment to access a pharmacist. They don't have to wait for their turn. They can simply walk to the counter, ask for the pharmacist, and talk to them in person. And this is a very big competitive advantage that we have compared to other healthcare professionals because we are technically considered on the front lines. That way you're going to develop that bond, you'll develop that trust with the patients, and that's why based on evidence and literature, we are among the highest trusted healthcare professionals worldwide aside from nursing. So we can play a key role during this pandemic in providing superior patient care. Next, please. Okay, so again, here I'll go into some detail. As a result of the pandemic, and this does not only reflect on the profession of pharmacy, all different healthcare professionals have had to adapt to the pandemic and have had to modify their systems, their roles, their responsibilities, management to adapt to the pandemic and for all the measures that we've had to take as a result of the pandemic. And pharmacy, of course, is no different than that. So what I'm going to do is I'm going to elaborate and lay out the different measures that have been taken that can be considered evolving roles of the pharmacists during this pandemic. So one of the first things that have taken place early in April was the HMC pharmacy department have decided to establish a home delivery service for medications to patients through the delivery service in Qatar Q Post. And the way this works as a system is you would call, or a patient would call, the 16,000 helpline. There would be an option that would ask if you need a medication delivery. You select that option. Once you select that option, you are routed to the operator, which will then ask you, where do you normally get your prescriptions filled? Let's say, for example, you say, I get my prescriptions filled at Al Wakra Hospital. The operator will then route your call to a live pharmacist in the pharmacy that will answer your call, will refill your prescription, will provide you counseling and education on the medication as far as how to take it, side effects, possible drug interactions, contraindications, you name it. And the pharmacist will also alarm you of any other medications that need to be refilled. So that way you get synchronization of all your maintenance refills and you will have to avoid, getting different deliveries sent to you. By taking this measure, the HMC pharmacy department was successful in ensuring quality of care to our patients, providing care in a prompt and safe manner, and adapting to the measures of ensuring that we would avoid traffic to our pharmacies, which would result in avoiding possible exposure of a patient to a virus or transmission of a virus to any of our settings. And of course, the second point I've already elaborated on, that the live-in pharmacists in the pharmacies would provide counseling for the patients that are inquiring about medication refills. Next, please. Another important measure that I could say the HMC pharmacy department has conducted that has been very successful is they have assigned also, as a result of this medication delivery service, three central fill hub stations in HMC that would fill all the prescription orders that come as a result of this delivery service. So basically, by doing that, once again, you're avoiding staff gatherings in, the normal gatherings and congestion in the pharmacies that would be responsible for dispensing, labeling medications, filling orders, dispensing them to the patient. By doing that, because earlier in the pandemic, what happened is one of the measures was 80% of staff were to work from home and 20% were to remain in our settings. By doing that, once again, you're avoiding congestion in our settings. You're having dedicated stations or hubs that will fill the medication, and you will help with preventing exposure or transmission of the virus. Now, another important evolving role that I think us pharmacists have been very successful at is we've also, in collaboration with infection control, have become infection control champions or advocates, if you will. And this has applied on the department level and even when dealing with patients. So what I mean by that is, the pharmacy team has been insured through the pharmacist to make sure that we're wearing masks at all time. We're making sure that we're always sanitizing, using hand hygiene when we're working with prescriptions, when we're signing papers, when we're labeling medications, picking up vials, you name it. And we're making sure we're maintaining distance at the pharmacy. We can also benefit helping the patients as well, where as part of counseling our patients on their medications, we can also elaborate on the fact that we are going through a pandemic right now. Please make sure, Mrs. Smith, for example, that you're adhering to the measures of wearing the mask at all times when you leave. You're making sure that you're always doing hand hygiene. You're avoiding social gatherings, and you are ensuring social distancing. So I think we also play a key role, once again, in being infection control advocates and champions during this pandemic. Next, please. Here's another very important step or important role that I think evolves that each and every one of us pharmacists and even students that are getting ready to be pharmacists should follow. The COVID virus is evolving not day by day, but hour by hour. Almost every hour we're learning something new about the virus as far as its complexion, as far as any additional new symptoms, as far as complications that may result as a result of this virus. Literature keeps evolving as far as new proposed treatments that might be helpful in managing prophylaxis options from medications to supplements. We must make sure as pharmacists we remain up to date through continuous education, reviewing literature, reviewing research, because we will be focal points that will be continuously consulted by other healthcare professionals and by the patients at large on medication therapy options for the COVID pandemic. I'll leave a little caveat here to please make sure that you only follow reliable sources for your continuous education. Please don't necessarily rely on whatever you see on the news or whatever you see on social media, Facebook, what have you, because a lot of the sources that you will see will not be evidence-based and reliable, and you cannot rely on them to gain the information. So what I'm trying to preach here is please make sure you rely on reliable sources, evidence-based information to keep yourself up to date on the COVID virus. Now, I'm going to get a little bit into the clinical part simply because my background, ironically, is clinical pharmacy. And I'm going to say that one of the other evolving roles that really has helped with managing during the pandemic is clinical pharmacists pre the pandemic used to participate up in the wards in the hospitals and interdisciplinary team rounds as part of the multidisciplinary team led by the physician. But now, as a result of the pandemic, what has happened in the rounds across HMC units in the hospitals is there has been virtual participation of the clinical pharmacists in these MDT rounds, where they still participate, they still get consulted on interventions, on medication therapy options, on questions on medications, but it is done within a virtual manner, where once again, we're making sure we're taking all the proactive measures, but at the same token, we're still delivering our service the way we should as part of the healthcare team. Another important benefit that has been gained during this pandemic and managing during this pandemic for the clinical pharmacists is we are now having the clinical pharmacists be granted remote access to patient profiles from their offices or even from home, where instead of doing one-on-one in-person assessments with the patient, they can actually do the assessment online, and they also can do their medication reconciliation online. Now, having said that, normally as well pre the pandemic, when a clinical pharmacist does their assessment and their medication reconciliation, they normally do it in person with the patient. But now we have the option where the clinical pharmacist can do their interview and provide any patient education and counseling on medications, either virtually or over a telephonic consultation. Next, please. Okay, once again, like I said, clinical pharmacists, I have to talk a little clinical here, and this will benefit all of us, of course. One of the other measures that have been done that I also think really benefited the pharmacy profession because it raises the profile that we are the medication therapy experts and we know which medication should be prioritized to be used, especially during this pandemic, is there has been restricted access to a few medications that are now part of the CDC hospital treatment protocol for COVID. And the restriction has been applied to hydroxychloroquine, which is in nature an antimalarial antirheumatic drug, azithromycin, which is an antibiotic, and oseltamivir, which is an antiviral. So for the time being during this pandemic, the decision has been made to restrict access to these drugs to only serve the purpose of dispensing by the ID physicians for our COVID patients, which are moderate to severe. Now, the question might come across, okay, Dr. Wissam, that's fine, we can restrict it. But what happens if we have patients that are taking this chronically for other conditions? Like I said, for example, for hydroxychloroquine, that's used normally for maintenance on malaria and rheumatoid arthritis. Well, the answer is very simple. Once again, this is a golden opportunity where we raise our profile as clinical pharmacists, and we will be consulted on what alternative medications we can use in the interim to replace these medications until, inshallah, the pandemic goes away and these medications will be readily accessible again. So here is where we can shine as a pharmacy team to showcase our skills and show that, yes, you can come to us. We're the medication experts. We will tell you what you can use instead. Another very proud thing I could share with the team is because our profile has been raised so much and because we've gained a lot of recognition and we're a lot more visible as part of the healthcare team, as Dr. Mohammad mentioned, there is also a working group in HMC that continuously reviews and updates the treatment guidelines and protocols for COVID-19 as a continuous thing based on the evolvement of the literature. And I'm proud to say that clinical pharmacists is actually a member of this IDT working group where they are once again consulted on medications, on what options to choose, what would be the consequences, what would be the privileges. Proud to say once again that now pharmacists are even part of a corporation working group that are drafting and continuously reviewing guidelines and protocols for COVID-19. So kudos once again to our pharmacy profession. I am very proud of this. Next, please. Okay, looks like I'm going to finish on time for the most part, which is great. Here are some future roles that I am proposing personally for pharmacists that will also once again raise our profile, build our confidence, and help us manage during this pandemic. I think to support the prevention of the virus and to support response efforts, pharmacists in the future should be given or granted privileges once they assess a patient and notice that this patient might have suspicious COVID symptoms. Pharmacists should be allowed the privilege to order COVID tests, conduct COVID tests, and interpret the COVID tests. And I say that, of course, upon us receiving the training on how to conduct point-of-care testing. And I can tell you from the United States, the government has already granted exception to pharmacists in the U.S. upon getting training, which, by the way, the training on this is very easy to do the swabbing. They've given them privileges, if they find reason to do so, to actually swab patients, collect the specimens, and interpret the results. And when appropriate, I also suggest that once the vaccine is available, and I will just touch briefly on this as well, the vaccine is not available yet, ladies and gentlemen. All the rumors you're hearing about Russia rolling out the vaccine, yes, they're rolling out a vaccine, but please keep in mind that Russia totally bypassed the phase 3 trials, which is an essential component as part of the trial review for any given medication or vaccine to ensure safety and efficacy. So though Russia rolled it out, I'm glad to say that Qatar actually wasn't one of the countries that has accepted this vaccine, and that does not mean that the vaccine will be effective, and as a matter of fact, might be harmful. So what I can assure you is there is ongoing trials. There is a promising vaccine that is actually currently being studied in Oxford in collaboration with a drug company, I believe. And the preliminary information we're receiving through the FDA is, inshallah, if everything goes well, by early to middle next year, we will have a vaccine. So if we do, again, didn't mean to digress that long there, but if we do, I strongly believe that pharmacists should be granted immunization authority and should be granted testing authority to conduct point of care COVID-19 tests. Now, my final point for the presentation and the final role that I believe pharmacists should be given privilege to is I believe also in this pandemic, pharmacists should be authorized to conduct therapeutic interchange on products that might be running out of stock or like drug shortages as a result of the pandemic without physician authorization. Now, before anybody gets alarmed, I'm not saying totally doing this without having any arrangements. In my opinion, this can be done one of two ways. It can be done by setting up a collaborative practice agreement. And what this is an established agreement between a specific prescriber, designated prescriber, and a pharmacist or group of pharmacists, where pharmacists will be given the privileges to do therapeutic interchanges either within a class of medications or different classes of medications as agreed upon and signed off by the physician and the pharmacist. If that takes place, I'll give you a simple example on a drug, hypothetically. Let's say during the pandemic, just to let you know, there's been a lot of studies that have been showing some promise in the utilization of the drug famotidine, which is an H2 or histamine 2 receptor antagonist that is normally used for ulcers and GERD, gastroesophageal reflux disease. There's been some promise in some studies saying that it can help in treating COVID. So there has been a lot of prescribing, not necessarily in Qatar, but worldwide they have been using this drug. So let's say hypothetically that this drug is running out of stock in our pharmacies here. And let's say that our pharmacists have been given a CPA or collaborative practice agreement arrangement with a physician where they can actually switch within the H2RA family to a different drug. The pharmacist in this case, what they can do is they can actually do the interchange, switch to another drug in the family if it's clinically appropriate based on the condition of the patient, based on any other morbidities, and they should be able to give the interchange themselves. Now, another option that would grant prescribing authority for pharmacists would be by granting authority by the government or the state itself, by the ministry. What normally happens, and these are two examples I'm giving you as options that are taking place in the United States as well. I'm referring back to the U.S. model. So in the U.S. as well, there are some states within the country that have drug protocols with classes of medication that are, a pharmacist can be privileged to prescribe on their own as long as they meet all the requirements to prescribe these medications. So if we are granted such privileges here, we can optimize the service we provide to our patients, we can improve the quality of care, we can enhance the access of patients to healthcare, and we can ultimately raise the profile of pharmacy. I know I went 5 minutes over. Thank you very much once again for the opportunity. I'm proud to be a part of this pharmacy event. And if there's any questions, I am happy to answer them. Thank you very much.
Thank you so much, Dr. Sam, for this informative presentation. It's really nice seeing, we always hear stories about the role of pharmacists in the COVID, but we didn't have like real life stories. So thank you so much for sharing this. Actually, I have here two questions in the Q&A box. One is asking, will taking the influenza vaccine make the immune system weaker for a short period, which will lead to being more exposed to COVID-19 infection?
That's a very good question, and the answer is no, it will not, because the vaccination that's being provided is an inactivated virus. It's not a live virus. So if anything, if you take this vaccination, it will build your immune system and it will make it strong to fight any possible exposure to the influenza virus. But to be very clear, Marwa and the person that asked the question, the influenza vaccine will not protect you from COVID. It will only protect you from the flu virus and will not protect you from any other possible viral strains that are out there in the atmosphere.
Thank you, Doctor. There is another question. What can we as pharmacy students help in fighting this pandemic?
Wow, that is a great question. Well, I can't spend a lot of time on that, but I think that we have come a long way in raising the profile of the pharmacy profession. I think the key message for my pharmacy students, our future generation, our pioneers in the movement of the future, is if it's something I can preach for you fellow students is, please continue to stay up to date on the latest in COVID-19. The field is evolving very, very quickly. There's a piece of news that emerges every single day. So as long as you stay current and up to date on the latest as far as proposed treatment options, prophylaxis options, vaccines, you will be the go-to person once you graduate for any information needed on the management and the medication therapy of the virus. So if there's a take-home message I preach for my students specifically, or for the students, I should say, is please continue to stay current and up to date with evidence-based information.
Thank you so much, Dr. Wissam. It's really appreciated. Now we're going to the next part of this event, which is a thank you video, which is prepared by the CPH students to all the pharmacists. Actually, this video took us like 3 to 4 weeks to prepare the script and film. And if we weren't in a pandemic, we would have filmed it in a better way. I will be sharing it in a second. Thank you all for watching. I just want to send special thanks to the video team and our media and marketing director, Sayma Hijazi, for this incredible video, and for all the class trips and all participants who were able, they could send us the video and then we say, no, you need to repeat. So thank you. I want to thank them so much for their efforts in doing this video. And now to this interactive session for some virtual games, which will be moderated by Fatma Nazar. She will share with you all the details.
Hello and good afternoon, everyone. Welcome to the World Pharmacist Day event for the gaming session. We hope you're having a really good time so far. And we have some really exciting and challenging games for you today. Marva, if you can please give me the book so I can start sharing my screen.
Yes, I will now.
So our first game is going to be a Kahoot quiz. I would request everyone to please log into Kahoot using the link that I just sent, or you can even log into Kahoot using your mobile phones. Just go to Kahoot and enter the game pin that I'm going to show you right now. So I can just have everyone log in to Kahoot using this pin. I'll just give one more minute so everyone can log in. Okay, let's start. So our first question for the game is, the World Pharmacist Day was established by which organization? Is it FIP, International Pharmaceutical Federation, ASHP, American Society of Health System Pharmacists, American College of Clinical Pharmacists, ACCP, or International Pharmaceutical Federation for Students, IPSF? This was explained by the dean during his speech, so it should be easy and everyone should get it correct. Yes, that is the correct option. And a very fun fact, it is established on the same day that FIP was established. So it's basically a birthday anniversary for FIP as well. Moving on to our next question. Okay, so we have Dr. Dan, our gaming expert, who's on top. Let's see if there is someone out there who can beat him. Which of the following organizations fall under the IPSF EMRO region? Is it RPSA Rwanda? Is it NZAPS New Zealand? Is it ASEPA Algeria? Or is it QFUS Qatar? Correct. Okay. Rwanda does not fall under the EMRO region. It is on a totally different region. QFUS is the one which is representative in the EMRO region. Let's see. Wow. Okay. So Khalud is on top. Let us have our next question. Which of the following was not invented by a pharmacist? Is it Coca-Cola? Is it Mountain Dew? Is it Pepsi? Or is it Dr. Pepper? All of these are beverages, or you can call them drinks. And one of them was not invented by a pharmacist or discovered by a pharmacist. correct option is Mountain Dew. It was not discovered or invented by a pharmacist. All of the rest were, in fact, made by pharmacists. Let's see. Okay, Dr. Dan is back. Is it true or false? Do pharmacists perform compounding at the present? Yes, it is true. Pharmacists do perform compounding to provide optimal patient care, and it is done at the present. What? Okay, so Dr. Dan is down again. Next, who is this? This is a very famous personality, and very short hint, our pharmacy new building is named after this person. So he's a pharmacist, and the building is named after him. Yes, correct. Ibn Battar is the pharmacist in picture over here, and the CPH new building is named after him. Let us see who we have. Okay, Wad is on top, then we have Dr. Dan, and then we have Emilet. And Aisha and Maryam are not far behind. Let's see, Ibn Battar's first book was. Now keep in mind that Ibn Battar is a pharmacist. So what would you think would be his first book, the first book that he wrote? It's a pharmacopoeia because he collected information on numerous drugs, and he collected them in a book, and he published them in the form of a pharmacopoeia. It's his first ever book. All of the rest of the options are not the names of any book in the world. These are just made up names that I made up. So, okay, we have Emilet on top, we have Wad and Maryam, and Aisha and Dr. Dan are not far behind. Let's see what our next question is. Which of the following is the most prescribed medication in the United States? Is it glucophage or metformin? Is it acetaminophen, paracetamol? Is it ritonavir, or is it lisinopril? This is very, very easy because it's very common medication prescribed in the United States. Yes, correct. Acetaminophen is the most prescribed medication in the United States. It's paracetamol. Let's move on to our next question. Let's see. Okay, Emilet is on top, and Maryam and Aisha are not far behind, and Dr. Dan and Wad are also climbing the mountain. Let's move on to our next question. Which of the following is the most expensive drug? Is it atorvastatin? Is it glucophage? It is Adderall or Glybera. It has to do with the function of this drug. What is it used for, basically? And the correct option is Glybera, and not many of people got that correct. Glybera is the most expensive drug in the world, with a single dose costing $1 million. The pharmaceutical company that started making it had to stop because there was only a single dose that was sold of this medication. It's a gene therapy, and it's very, very rare. It's for a very rare disease. Moving on to our scoreboard. Okay, we have a new person on second. It's Dr. Allah. Good to see you. Emilet, Dr. Allah, Maryam, Aisha, and Dr. Dan. Let's move on to our next question. When was the CPH building open for the faculty and students? Is it the 1st of September 2019? Is it the 1st of September 2020? Is it 19th of 2019? Or is it 7th November 2019? We recently had our first year anniversary. It was a very huge deal for us. This should be easy. correct option is 1st September 2019 was the day when the CPH building, the first CPH building was opened for the students. So this was the last question for this Kahoot. Let's see who we have on our podium. So Maria, congratulations for being third. Dr. Ayaz, congratulations for being second. And who we have as our star? Evelyn, who got all the options correct, all the answers correct. Congratulations, and congratulations to Elena as well, Aisha and Dr. Dan. So this was all for the Kahoot quiz on this. Now we have a different game for you, and I would like you all to log into Kahoot again using a different pin. If everyone can log into Kahoot using this pin. And I will tell you a little bit about the game. While everyone is logging in, let me explain to you what the game is. This here is an emoji or an emoticon. We use this in our everyday life to express our feelings without actually using words. But today we're going to use it to decipher the drug name. I want you all to look at the drugs carefully, and what happens is you have to name each of the emoji, and it will represent a drug name. So I repeat, the question is that you have a couple of emojis, you have to name the emojis, and you have to pronounce them, and it will be in accordance to the name of a drug. All of the options are the name of a drug, so you will have some challenge there. But only one of them is actually quite relevant to the emojis that we have. Let us give it a try with the first question. So here you have two emojis. So there's an emoji. The drug name has this, and then there's a V inside the drug name, and then it has this name of the emoji. Only one of them is actually quite relevant to the emojis that we have here. Please make sure that you put on the basis of the pronunciation as well, because sometimes the drug name is relevant to the pronunciation of the emojis and not the actual emojis themselves. And that is correct. It is acyclovir. The first emoji was a cycle, and then you had a V in between, and the other one was an ear. So it's an acyclovir. That's how this game is going to be. We had to put in a little bit of challenge for everyone. So let's see. We have Halima on top with Dr. Dan and Lana not far behind. Aisha and Faima are also catching up. Best of luck to the rest of the attendees as well. Let's see if we can solve this one. A little hint for everyone, it's an antibiotic. So this drug is an antibiotic. I know a few of them are. So. And the correct option is Cipazolin. The first emoji was a chef. Then we have the word AS, and then we have a violin. So it's Shifazole or Sifazole. This is how the game is, and let's see who got it correct this time. Okay, we have Halima on top with Mariam and Emilet on second and third, and Dr. Dan and Mara are not far behind. And so we have Sabah as well, who is also our contributing climber, and she is also catching up. Let's see our third question, and let's see if you can guess this. This is very easy, by the way. It's so easy. It's right there. There's only one that has the relevant name. Another hint, this is an antibiotic, and yes, it is doxycycline. I think everyone got that correct. There were dogs, there was a C, and there was a cycle, a person cycling, so it was doxycycline. Let's move on to our next one. Okay, so we have Halima on top again with Mara and Zaina second and third. Dana is also catching up, and so is Dr. Dan. And we have Dr. Ziad as our highest climber as well. So we surely can see him on top 5 in the end. Let's move on to our next one, the fourth one. This is a bit of a challenge, but there's a very huge hint over here. There's only one option that has that specific name. So yes, correct. It is penicillin. You have a pen, and you have it, and you have the chilling emoji. It's penicillin, or pen is chilling. Moving on to our last one, let's see who we have on our scoreboard right now. Halima is again on top with Mara second and Dana third. Dr. Dan and Zaina are catching up, and we have Emilet who has a streak of 4 correct answers. Let's see what our last drug name is. Is it vancomycin, buscopan, moxicod, Terafix? Only one of this is actually the correct and the relevant answer. Yes, correct. It is vancomycin. The first, I know why buscopan could also be an obvious answer, but the first emoji was a van. It was not a bus. So it was vanco, and then there was a parent with his son, so it was my son, so it was vancomycin. Let's see who are our scoreboard leaders. So on third, we have Zaina, who got all of them correct. Congratulations. On second, we have Dr. Dan. Congratulations again. And on the first, we have Halima. Congratulations to all of you for getting all of them correct. And our runner-ups are Dr. Diab and Dana. Congratulations to you too. It was a very challenging thing, and it's actually a good thing that you got all of them correct. Now let's move on to our other more challenging game, which is you have to switch to another application. If I would ask everyone to please log into WhoopLab using this link, just scan the code, or you can use this link and log in. I'll also copy this and send it in the chat box so everyone can access it. Okay, as everyone is accessing it, let me explain you the objective of this game. This is the most challenging game that we have in this segment. and it is, we will spin the wheel and you will have an alphabet. Your job is to sign in with the name of a drug and a disease from that alphabet. Please make sure that you write your name first, and then you write the drug name, and then you write the disease name. As Lana will monitoring you closely as who answers first and who answers correctly. You cannot make up names of drugs and diseases as you go. So you need to have correct drug and disease name, and it has to start with the alphabet that we give you. Okay, I'm just going to give everyone 1 more minute, and then we're going to proceed on. So let's start with our first alphabet. The alphabet is O. Your objective is to find a drug name and a disease name from this specific alphabet. So you have to name a drug and a disease from O. And please make sure to write your name first so we can know who is the winner in the end. That's a challenging one. Okay, we have Dr. Diab as our first answer. It's olanzapine and osteoporosis, correct? Do we have any other participants? This is quite challenging. Omeprazole and heartburn. Heartburn is not starting from O, Rahma, so we cannot count that as an answer. Dr. Allah, Parkinson, Dr. Allah, the letter was O. So, so our winner for this round are Dr. Diab and Dana and Halima, because they are the ones that answered correctly and they started from O. Let's move on to another round of the same game, and I'll choose an alphabet again. Okay, this is going to be really easy. The letter is G, so you have to name a drug and a disease from G. This is our last round for the gaming session, so please make sure that you do have an interactive and contributive effort here, and please write your name so we can know. Dr. Diab again, gabapentin and Graves' disease. Wow. Yes, okay. Then we have Dana, correct. Then we have Marwa, correct. Then we have Dr. Allah, correct. Halima, correct. And that is all. We have not seen a lot of contribution in this game, and I assume this is because this game is challenging and difficult. So, yes, Amila, that is also correct. Gentamicin and gout. Mariam, gastritis, labyrite, yes, correct. We also had a drug right now that I just had in the previous session. It was Libera, so you can also mention that. So our winner for this round is Dr. Diab, Dana, and Marwa. And then on fourth, we have Dr. Allah and Halima. Congratulations to everyone. That's all that we have for the gaming sessions for you today. I really hope you enjoyed the session, and I really hope you had an interactive information as well as contribution from yourself. Let us move on to our next most exciting round, which is about the competition that we had among the CPH students, and my friend Marwa will tell you more about it.
Fatima, can you meet me the presenter? Okay, now to the exciting part. I think all the participants here are waiting for it. 2 weeks ago, we announced a competition which involved submitting a video with the theme of building resilience in pharmacy students, where students were asked to reflect on some questions related to the COVID-19 and the beginning of the pharmacy study or this semester. We had actually 2 amazing contributions, and today when we were counting the votes, we were amazed by the interactions on the social media. We had, like, on each video more than 300 likes. Even on Facebook, we had more than 150 likes, so we're amazed by the interaction, and that showed that both videos were amazing. But counting on the votes, 50% on voting on the link and 50% voting on social media, we had a winner, and the winner is video won by Duha Akasha by 60.2%. The video was amazing. Thank you so much for your participation, and thanks also to Sana for her participation. Her video was amazing, and it had many likes, especially on the Instagram. I will now screen the video which Duha made. So that was the winning video by Duha. Thank you so much, Duha, for your contribution, and again, congratulations. And also thanks Sana for her amazing video too. I think we came to the end of our event. I would like to thank you all so much for attending, for thanking our Dean, Dr. Mohammad, Diab, Dr. Ala, and all the participants, all the contributions, and also thank Dr. Wissam for his amazing informative presentation. Would like to thank the QFIS team for their immense job the past 4 weeks when we planned to do this event. They did a really great job, and also thanks to Hind, although she's not here, but she managed to do incredible job. Last but not least, to thank the IT, because without them, we wouldn't have a full presentation. Does anyone want to say something before we end it? Dr. Ala, maybe?
Yeah, just wanted to thank you, Marwa and Fatima, for leading today's event. You've done an amazing job. I also would like to say thanks to Dr. Wissam for his great presentation. And congratulations to the winners, Duha. Thank you, and inshallah looking forward to next year's celebration, hopefully in person. Inshallah it will be in person.
Inshallah, we hope so, to have the event back on campus and see like real life faces. Inshallah. Thank you again, and have a nice day.